Thanks, everybody. Thanks for having me. I'd like to acknowledge the traditional owners of the land in which this meeting is taking place and acknowledge elders past, present and emerging. So I guess I'm going to talk a little bit about what my role is when I see a patient with NF-1. I guess for me it's a neurodevelopmental disorder, that's how I frame it, and it's a condition that's really not just spots. So when someone previously mentioned, is it worthwhile having a dermatologist in a multidisciplinary clinic? I would say my observation of seeing many of these children is that this aspect of NF probably requires more assessment and intervention than those more physical aspects which we identify with NF-1. But I'm going to be clear and say that not all children with NF have developmental problems. So this is not for every child. This is just for a specific group of children that we're going to be looking for these problems, and not all children with NF will need to see a paediatrician. This is a busy slide, but I guess it's a framework that I use in my mind when I see families and when I see the child, is what are the things that I'm thinking about? And this is in no particular order. So I think about delays in development, so particularly motor delays, so gross motor delays, muscle weakness. I think of speech and language impairments, which you're going to hear a little bit more of following my talk. The other things we know is that children with NF, quite a significant proportion are going to be diagnosed with ADHD, so around 40%. The reason I've put the H in brackets is because we probably see more inattention than we do hyperactivity, so inattention is more important. We also see in around 40% impairments in reading, written expression, math, spelling. For the general population of children with NF, the average IQ in the non-NF-1 community is about 100. In the NF community, the IQ is probably 90, 10 points below. We also know that children with NF can have difficulties with social functioning. And so what do I mean when I say that? I mean difficulty making friends, not reading social cues, not recognising the emotions in others, preferring to play with younger children. As in addition to that, some children, up to 40%, will also fulfil the diagnostic criteria for autism spectrum disorder. So in that disorder, there are problems with social communication and social interaction, but there's other issues that go with that as well. And I'm talking about restricted and repetitive behaviours which probably come about because of sensory responsiveness, so being very sensitive to smell or foods. Like many other children I see, so no different, but I do see, we do know that there is anxiety and mood disorders, and I see lots of young children with NF with anxiety disorders as well. And the other thing that they can get is executive dysfunction, which I guess from a simple way of thinking about it, even for me, is just difficulty with problem solving and task switching, which you can imagine is important in your day-to-day life and when you're in the classroom. I guess from my perspective, why is it important for you as parents of children with NF-1 to know about this? Well, we know that in children with neurodevelopmental disability, that early intervention is the key. So if you know about it early and you understand that this is something that might occur and you're going to have to look out for, then you can go on as a family and get the early intervention that your child needs. So that can be through the NDIS, which you've heard about earlier in the morning, with speech therapy, OT, physio. I have a lot of my NF patients who see allied health therapy in the earlier years and sometimes in the school-age years, and it's very beneficial. For the school-age child, what's important is the remedial supports at school and the extra supports that the school can put in place. But they need to know about these things if they're going to put things in place. There's a role for medication for some of this neurodevelopmental disability, in particular ADHD. We also use medication for anxiety. But it's important that for you as a parent that you can advocate for what your child needs, and then you can be proactive because you're the advocate for your young child or even older child. So you may say then, what is it that I'm looking out for? What do I need to know so that highlights to me that this is something that I should get looked into? If you've got a younger child with NF, the thing that I would be looking out for is developmental delay. So delay in your gross motor skills, but particularly in language. For those of you with young children, you'll know that children start putting two words together around 18 months of age. More food, up here, things like that. And so you might notice that your child's not putting two words together by 2 years of age. As this little picture shows, they might not be using gestures that they should otherwise use. So if children want to show you something, they need something, they want to share something interesting with you, they'll use their finger to point and indicate that they want you to share in what they're looking at. Other things that you might observe is that the child is not particularly responding to their name being called all the time, or they're not looking at you all the time. And those can sometimes be pointers to social difficulties and difficulties with social communication. In the older child, sometimes I would notice that in children who are inattentive. You know, they're so not paying attention that they haven't got time to look at you, and they're on to the next thing. The other thing that's important for parents to, I guess, observe is how does their child play, and how do they play? Do they use imaginative play? Are they being creative in their play? And so what I mean are things like being a superhero, making a cup of tea, pretending to talk on the phone, but it's not a phone, it's an object. And we usually see pretend play develop around 12 to 18 months. Other times, families notice that their child has difficulty pronouncing words or their words aren't clear. And as I've mentioned, in some children, the parents will notice that the child is just a bit delayed in walking. So normally I would expect the upper limit of normal for a child to walk would be 18 months. So you might notice that your child has only walked at 2 or 2 years and 2 months. So not that delayed, but just some months after the usual time period. You don't have to remember all this. There's the Raising Children website is really fantastic. I use it a lot as a paediatrician. It's been written by a lot of my colleagues, and really there's a lot of information there about typical development, but also about behaviour and sleep and ways in which can help. So if I'm even, if I want strategies to help families around sleep or language or improving language, I'll often be using this website. The school-age child, which is probably what I see a little bit more of, there might be different observations. So the teachers might say to you, I'm a little bit worried about your child's concentration, their behaviour, they're on the go, they don't sit in their seat, they want to get up all the time. You might see their school report and you think, gosh, they're not doing as well as expected, and in some areas they're doing okay, but in other areas they're a little bit behind, such as in literacy skills. You might also notice that your child's got anxiety symptoms, and anxiety in children is different to in adults, but It can manifest as physical symptoms, frequently abdominal pain, headaches, and just not wanting to go to school. Speech difficulties, usually I would expect by the time a child gets to school, so usually after 4, that all their speech is intelligible to people who don't know them. So sometimes you might notice that your child's speech is difficult to understand. There may also be concerns about how the young child is socialising at school. And a lot of the time I get told about fatigue with walking long distance, and my child just really doesn't like walking and they get really tired really fast and it really hurts, and that's a really common complaint. So I guess I'm talking about my role as the paediatrician integrated into a multidisciplinary clinic, but this should be no different to any other paediatrician that families can see. We're all trained in how to take a developmental history, how to manage ADHD, how to manage learning disorders. I think the key for me, though, is just maybe there's less understanding from paediatricians who don't necessarily work in the NF space that the prevalence of some of these conditions are actually more common, and so they actually don't know to look for it. But for me, so I get a referral from one of my team members, from the geneticist or the neurologist, to say the parents have raised some concerns about school, or I've noticed that there's some developmental delay, and that's usually how I'd get involved. So like any other paediatrician, though, I would take a history from the beginning, basically a birth history, a developmental history. Sometimes there's actually, by the time people have seen me, they may have already seen a speech therapist, an OT. They said, yep, we did that a few years ago. We finished with that now, and then they're now in school. I ask about family history, parenting approaches. I'm interested in sleep. But then it's also important that I get information from other sources, because if you've got a neurodevelopmental issue, what we expect is there to be observations in another environment to confirm that. So it's not just that your child has difficulty with attention at home. What I need to see to fulfil diagnostic criteria, but also to get an understanding of why the child behaves differently in different scenarios, is actually how are they going in those different settings. And this is what takes a lot of my time, as you can imagine. So I spend a lot of time contacting schools. So I really like it if parents could come with email addresses of school principals, or they can come to me with a letter. They said, oh, I've already spoken to the teacher and I've got some information that I can share with you as to what's happening in the classroom and what the concerns are. Because really what I'm doing is I'm building a picture as to how your child is functioning in the school environment, and then I'm asking you how things are going in the home environment. So I'm getting a really full picture to understand what the issues are. So then I make an assessment as to whether I think there's a neurodevelopmental diagnosis. I make an assessment as to whether I think the child has developmental delay. And at this point in time, I say to families, well, this is a point in which, regardless of what I say, this is an opportunity to educate people about the condition and the school and about what might be helpful. So what I find is at this point in time that I'm seeing families, the school may not be aware of a diagnosis because the child might have been doing really well and really there's not big issues, and it might not be that I've identified anything, but I still think it's an opportunity to provide some education to the people in the child's school network, childcare, so that they can support the child the best way that they can. So what I usually say, as I say to them, this is a condition that is more than just your spots. I'll often say to the young person, what does NF mean? And they might say, oh, it means I've got these spots here and that you check my eyes. But it also might be an opportunity for me to say, well, this is this is a time in which we might think about how it affects you at school and how your learning's going and what your concentration's like. So I actually provide some very useful information, which I have got from the CTF, which I'll show you. And I also then provide my own letter that I've written that just goes out to usually the assistant principal or the teacher. So this hopefully looks familiar to some of you. So this is the toolkit for teachers that the CTF has provided. And I think what's important, I guess, is I'm focusing on the red circle area, because I think the stuff on the left is probably more obvious to those maybe who know about NF in the community. Oh, yep, they get spots and, you know, maybe they need their eyes checked. But actually what I'm saying to teachers, it's the stuff that you can't see that is really important that you know about, because it's going to be in those areas that you're going to need to be able to provide some support and maybe some scaffolding for the child in the classroom. So you can see here 50 to 80% of people with NF will have learning difficulties, and it gives them a bit of a rundown. I've then just come up with my own letter that I send. I have a discussion with the family. Is it okay if I share this information? I make it general, because it's not necessarily specific to the child in front of me, but it's just specific. It's for any child with NF. So I say that it's a lifelong condition, it affects many parts of the body, and I make a comment about learning, attention, social skills, ADHD, ASD. You can see that described there. And then the bits I underline are the bits that I actually want them to do. So that's the action for the school. So I say, could you please have an individualised learning plan? And then I say, it might be useful to link the child in with the school counsellor if there's social difficulties. So I try and it has information, but it's also got some actions for the school. So that if I contacted the school back again, I'd say, so how did you go with those things that I suggested? So after I've taken a history and I've gleaned some information from the school or the childcare, so I actually do spend a lot of time speaking to childcares as well to get information from them about the younger child and how the younger child socialises and gets on with other kids their own age. But I'm then wanting to supplement my assessment with some assessments if I need to. I don't always need to, and I might not necessarily do it at that point in time. I might think about doing it 6 months later or a year later or 2 years later. This is not necessarily at the initial assessment. But this is the things that I have in the back of my mind. And I think these are things sometimes it can get a bit confusing when paediatricians start talking about assessments and how to get them. But I guess what I'm interested in, I'm interested in the child's cognitive profile, because that might help me understand what the best way for them to learn in the classroom. I'm interested in their language skills, and I'm interested in their attention. For the younger child I see, and as I said, I do see lots of younger children, sometimes under 3, I might not need any assessment, because as you'll see when I talk a little bit further about intervention, you don't necessarily need assessments at that age group because of the way in which younger children are able to access support. So this is my summary slide, and I know it's very busy, but I was trying to organise my thoughts as to when I have a child with all of these things to consider, what are the useful tests that I might ask parents to consider getting? Because then the hard bit is of course, how do you get it? The easy part is maybe what do you need? The harder bit is how do you get it? So an IQ test or a cognitive test, and tests of achievement. So they're looking really for specific learning difficulties, the Wyatt. And your IQ test is, as you would know, an IQ test. We'll hear from my colleague shortly about neuropsychological assessment, but you can get, I guess, an even more detailed assessment, which is a neuropsychology assessment, which includes other things, looks at attention, looks at many other things. The other thing I might think about is a speech and language assessment. Are the difficulties I'm seeing with the child who's learning maybe related to language? I've got some questionnaires that anyone can download on the internet called the Vanderbilt questionnaires. Occupational therapy assessments. I actually have lots of families that access and pursue OT assessments, which can be really helpful because the OT assessments look at your motor skills and look at how, whether your gross motor skills and your fine motor skills are in the average range or not. And often when children with NF have these assessments, they are below average. Sometimes I might get a developmental assessment. So that means where I work, I can get a speech and an OT to do a one-off assessment if you're under 5. So sometimes I might do that if I want some more information for an NDIS plan, but I don't do that very often. And the other thing is an autism spectrum disorder assessment, which is a completely different discussion, but I thought I'd touch on. So who can do these things, which is the important thing? Because if you, as the parent, you're going, okay, you've told me I need all these tests or that some of these tests might be helpful, but who's going to do them for me? And that's not an easy answer, but I guess I'll start with the school. So the school can do language assessments and cognitive assessments if they think a child is going to be able to have a severe language disorder or an intellectual disability, and that will get them funding. And that's not the majority. That would barely be any of the patients that I see because not many, most of the patients I see are not going to have an intellectual disability. And sometimes the school can really push back on that. In that situation, I sometimes contact the school. I say, can you do it? Can you do it? And I might send a few follow-up emails to see if that can be done. So that's one option. The other thing is accessing services privately, so with a private neuropsychologist or an educational psychologist, a private OT or a speech therapist, public OT or speech therapist, and there's different avenues in which you can get these done. At the Royal Children's, it can be done as part of NF-1 research. With the ASD assessments, for younger children, a child can be diagnosed with autism just from seeing a single paediatrician, so me. If I can get enough information from childcare, I can do a single assessment or a single clinician assessment. But often for children with NF, it's a lot more. There's a lot more complexity because of the language difficulties, and so often I am asking other clinicians for information, and so that process around an ASD assessment can take some time. So just briefly, what's ADHD? I think you probably all from a community perspective would know a little bit about ADHD, but it's often diagnosed when you're a child. It actually is supposed to be diagnosed before you're 12 years of age, and you have to have evidence of inattention before 12 years of age. It used to be 7, but now it's 12 years of age. And below where you see some of the signs of ADHD, and I've boxed zoning out at school, and that's really quite specific to children with NF-1. So difficulties with sustained attention, so their attention drops in and out. They might daydream a lot, forget things, talk too much, make mistakes. I wanted to comment about forgetfulness because a lot of families say to me, I think my child's memory is deteriorating. And actually, on reflection, I think that's more related to inattention, and it's just that they're not quite they're not sort of stopping and listening and hearing what you've said. And so it seems like, a lot of parents do say that to me, that they think that their cognition is deteriorating. But we know when we test them that things are stable, but probably things like inattention are the cause of that. They have trouble taking turns, and sometimes just have a bit of difficulty getting along with others because they sort of get right up to other kids and chatty, and so some other times other children can find that a bit too hard. So we talk about behavioural strategies for ADHD, and again, this is all from the Raising Children's website. It's, as I said, it's excellent. So we there's a whole section on this, and I guess what we're doing with behavioural strategies is just using strategies to make your child be more cooperative, I guess, is how we're managing the inattention. And I see lots of families where actually they're already doing this at home, like it's part of what they already do to manage the child's inattention. So praise for positive behaviour. It might be things like, I really liked it when you waited with your hand up before you spoke out, or I really liked it when you waited for your brother to, get his drink before you got yours. So those sorts of things around positive reinforcement when your child is doing what you want them to do. And daily routines are really important. And the mornings can be really difficult, and setting up schedules and visual schedules and having enough time to eat breakfast in the morning and for everyone to get dressed are really important aspects around managing ADHD. This is available on the RCH website. These are just some strategies for school. Sometimes I print this out and give this to families, but you can read briefly through that as well. So learning strategies provide one-to-one instruction. Make sure that children might be doing the hard stuff in the morning and they've got lots of breaks, and they're doing the easier stuff at the end of the day. So I guess treatment with medication is something that I do very often. We know the evidence is that medication has an excellent effect above behavioural strategies. And it's good to do both together. The most common medication that we use is stimulant medication, Ritalin, and we use it because it's actually the most effective, and it's been the most studied medication over decades, and it's very safe. The PBS says that I'm allowed to use it from 6 years of age. So most of us would feel very comfortable using it from 6. Sometimes I might go a bit lower than that, 5.5 if I really needed to, but other than that, usually around 6 we would consider it. So it increases dopamine and it reduces the symptoms of inattention and impulsivity. So the young person or the child is able to concentrate, control their impulses, and really importantly, follow through tasks while they're on medication. But when they're off the medication, that doesn't happen anymore. Okay, so that's really important, that these medications help with attention while you're taking it and you have a level of medication in your system. So what we usually do is we, by law, are supposed to start with a short-acting medication. So we start with Ritalin, and Ritalin lasts only 4 hours. So what I say to parents, if it doesn't agree with them and you're really worried about it, well, it's going to be gone in 4 hours. Okay, so it's not like taking other medication where it takes 2 weeks to work and then there's a sustained effect. This is a very on-off medication. So if it only lasts 4 hours, you've got to take it at 8 o'clock, midday, and then maybe again, say 3:30. And then once a child has tolerated that and I know what dose works, then I can change to a medium acting, an 8-hourly dose, or a long-acting 12-hourly dose. And so really that's a discussion that I have with families. Everyone responds differently. Some families say, God, that short-acting stuff was so good, and whenever they go to long-acting, they say it just didn't work as well. So we want to go back to the short-acting. Obviously, if you're at school, the young person's going to have to go to the nursing bay to get that lunchtime dose, and that's where we might use long-acting, particularly when they're in high school, because then their friends don't have to know that they're taking a medication. Then they might not want anyone else to know. And I think, as Kylie's already touched on, you need 6 monthly appointments for scripts, blood pressure and height. I'll just make a quick comment about developmental delay. So you should have already heard that the pathway is a little bit different for children with developmental delay, and the NDIS will allow anyone, most children under 6, I usually write a letter saying I say developmental delay, they've got issues with speech and language and play and learning, and the child will be eligible for funding. So that's usually a very straightforward pathway. And I have to write the letter so that to say that there's a reduction in functional capacity as well. And what's really helpful is then you then get funding for speech, OT or physiotherapy. Just a comment about the NDIS in school-aged children. Sorry, I'll go back and say, so what do you need as a parent for NDIS? I often ask parents who I say, how did you do it? Because I want to know how did you get that funding? And there's some really amazing families that I see that have been very proactive and who really know what it is that they need to get funding. And it'd be good to share that information amongst the group, because I think there are some people out there who are really knowledgeable about how the system works. They've often said to me, you just get as many reports as you can, so that's a report from the speech therapist or the OT or the physio. Sometimes I will write a letter for the school-aged child as well, and then the CTF also has an NDIS form which you should include. And so I think you've probably heard that it is a bit trickier for NDIS funding for children over 7 years of age if they don't have another diagnosis, because NF-1 doesn't make you automatically eligible. So what other diagnosis would get you funding? Something like autism, level 2 onwards would get you funding. An intellectual disability with an IQ less than 70. But this is where we need more work to be done as to how we get around this issue of NDIS funding for the school-aged child. That's it, thank you.
Thank you, that was amazing. Do we have any questions in the room before I jump to the ones online? Yeah, this one. Sorry, we're going to get you the microphone before you can speak.
Rather than a question, can I make a statement? I'm 71, and some of the things you were saying makes me think back to when I was growing up. A lot of the things that you said was exactly me, and how I was treated when I had trouble growing up, and I had trouble making friends, and the teachers at school treated me abominably because I was different growing up with NF. And I never got an education. I was actually kicked out of school. And I haven't even got year 7 because I was told I was stupid, I couldn't do this, and I couldn't make friends because of my NF. It was just, so what you were saying really fitted me. And it's amazing now how it's all coming together, and children are being looked after and treated amazingly. And it's great.
Well said, thank you.
It is.
I mean, I think that brings us back to education, isn't it? Because education is power, really. And I think being an advocate for the child is really important, because I think there is a lot of hesitation about how much should we tell people. And I have a lot of families say to me, I don't know if I should say too much because I don't want teachers to read into it too much or overthink it. But I think providing education is still really important.
Because I asked one of my school teachers in year 7 about the solar system and the universe, couldn't it be other planets in Earth, like Earth we had. Sorry for that. I actually asked my year 7 science teacher if there were the universe, solar system with Earth, and we had beings on it, couldn't there be other planets out in the universe with beings on it? And she said, no, you're absolutely stupid, don't be such an idiot. And and look what's happening now. And so I'm thinking, wow, it's so good what's happening. I probably had ADHD and had other things, I've got NF. But I'm so happy that because no one knew, I wasn't diagnosed till I was 17. In 1968, but it's so great. I'm so happy now that NF is recognised as a condition, and it's unbelievable. It's just so fantastic that CTF is going, and the Children's Hospital is helping so many kids because it's amazing. It's so good.
Thank you.
You're welcome.
I'm just wondering if you have any suggestions or magic tips on how to actually get through wait lists for services. I'm not exaggerating when I say I've been trying to get my son a speechy for 2 years now.
Not really. I mean, sometimes, even if I call, because sometimes I do get so frustrated that I call myself, but it doesn't actually get me very far. You know, sometimes I have more wait, particularly in schools, but I don't find with speech waiting lists it's really tricky. I haven't found a way around it, to be honest. I'm sorry.
I'll put one through online. When coming to NF Clinic, would my son, who has recently been diagnosed with NF2, who also has autism and possible ADHD, be eligible to see a paediatrician RCH? Also, are there any known links between NF2 and neurobehaviours?
Can I say I don't know? Because I only ever see children with NF1. Maybe Kylie, can you comment about, have I ever been asked to see any of those families that come with NF2?
It's a pity Gabby's not here. I can't say that we've had really many with NF2 requiring the services of our paediatrician. But having said that, next time you're seeing your clinician, let them know or make sure that they know that you have got a diagnosis, and we might be able to direct you at least to the right person that can help you.
Are you in Melbourne, or, sorry, did you say you're in Melbourne?
Yeah, you did say RCH, yeah.
We will
I'm assuming it
we'll follow that up, I think is probably the best to say.
We'll follow that
thank
up
you.
with you as well. The other one in the room? Yep.
Sorry, I've had an experience with NDIS where I just got approved sort of around, my son was 4 turning 5, and obviously because of all our Melbourne lockdowns, no one was taking on new clients because it's a little bit hard to make a connection online with new clients. So now he's 7, and now they've basically taken the funding from me, and I've only just, like this lady here, I've only just found a speechy and an OT that's willing to take us on after being, on very, very long waiting lists. Would you have any advice?
No, I mean, I think what probably I have thought a bit about it over the last year is maybe me getting in touch with some families who I know who have school-aged children who've been really successful in NDIS applications, and maybe getting their experiences of what they've done differently to get the funding. Because, if with the child in front of me, could I pick who would get NDIS funding? No. There doesn't seem to be particularly big differences between those children who do and don't get NDIS funding. So I don't understand why they don't. I do call NDIS, but there's only so much time that I have, so I can't do everything, unfortunately. I'll call NDIS for families who there may be a language barrier and they're going to close or something, and I'll get on the phone. But I think that's probably the next bit of work for me, is to say, well, I do have names of families that I've collected over time, and so maybe linking with them, saying, look, how did you do it? And often they'll say to me, I didn't get it the first time, I just kept fighting back and back, and put money into private assessments, which then they sort of got back because they then got funding. It's actually having the assessment done. But I hear what you're saying, you can't get your language assessment because it's a 2-year waiting list. So unfortunately we're all working within the same system, and it's really tricky. But again, I'll come back to you on that. Maybe we can sort of put something together that's quite specific about what are the things that we found that have worked with the school age NDIS. Did you ask that question to the NDIS person this morning?
Have the question time. We'll have to follow that one up with the NDIS.
Yeah, maybe we'll do that as well.
Sorry, I just want to reiterate that we have had a lot of success with getting families NDIS support. Probably about 70 families we've managed to get over the line, not all of them on the early intervention side, so it's when they are over 7, it's a bit harder. I mentioned this morning that we talked to the Health Minister about this, and so we have got the sheet that Deena put up a minute ago. We find that having a letter from us with as many reports as you can get. The difficulty is the local area coordinators or the person who is assessing your application, they're highly likely to have not ever heard of NF before. So it has to be spelt out to them very clearly what NF is, how it meets their criteria. And so the man this morning, if you could work out what he was saying, was about the functional impairment and the impacts on daily life, and you have to make that very clear. And so we've gotten pretty good at writing that. Out of all of those applications that we've supported, we don't fill out the forms for you. We can't offer that level of service. But with the letters of support that we've put in, there's only been 3 that we've had to appeal. So, and we will appeal them. And Amal will tell you, I'm very good at yelling at them if I need to. So please get in touch. All those playing along at home as well. We are a bit short-staffed at the moment, so please bear with us, but we absolutely are able to help you. And yeah, the take-home message is persevere, because you are entitled to it.
And I guess to that point as well, there was a question that came through, how can I get a copy of the letter that you put up to the school? And I imagine that's only available to people you see.
Provide it to you guys if you'd like, and then you can
Pass it on
put
to
your
you.
stamp on it or whatever.
To be modified by another paediatrician potentially? Like, is that, I don't know where they're from, but...
I just made that up, that letter, but yeah.
Yeah, but I know,
put
but I
it
guess
into
all the information in there is something that they could just...
It's very general information, so I'm happy to share it as well. That's fine.
Okay, we'll make sure that gets out as well to anybody who's playing along online as well. There's just some general comments around thank you for this, such a fantastic explanation. And another one was, you mentioned that early intervention is important for children to access allied health supports and get as many reports as possible to provide NDIS. What are the options for families who can't afford private health, such as OTs and physios? And I think we sort of talked about the fact that there's a long wait
So
list.
the other option, so you don't use your private health funds for those. So usually and I should have mentioned this before, is because your child has NF and they have a chronic condition, they will be entitled to a chronic care plan, which you can get every year. And that enables you 6 allied health sessions per year. I can also provide some information. So your GP does that, and so you can do it for a speech pathologist, an OT, a psychologist, and because the chronic condition is NF-1. So everybody's can get that. So that would be another way around it. Yep.
That was all for online. Was there anybody else in the room that had another question before we move on? No, thank you. Thank you very much.